Before I start with this episode, I just want to give a quick shout out to Podmetrics. Yup, Podmetrics is the platform I use to get all the data I need for the show. From who listens to me, all the way to where they come from, Podmetrics takes care of all of that so I can make better content for you. You can even integrate Podmetrics with Facebook and YouTube so you can get more data from your live streams. So if you're a podcaster or want to start your own podcast, go visit podmetrics.co and sign up for free. Use my code JakeOfAllTradesWithDelRo. With that out of the way, cue the intro music. What is going on, everybody? Kamusta kayo lahat mula sa Luzon, Visayas, Mindanao, or wherever the heck you are on the planet? This is your one and only Jake of All Trades, the place to be for any niche, every genre, and all generations. I am your master of ceremony, D to the E to the LRO, aka JDR, aka the extraordinary introvert. So, what's up, everyone? We are back with another episode, and as you guys can see, the doctor is in. But no, I am not the doctor here. This next guest, though, is the doctor in the house. But he is not just a doctor. He is one of the best of the business. He is literally the cream of the crop when it comes to this industry. Because as I will introduce this guest, he is another product of the Ateneo. He was the Sango president back then, from 2012 to 2013. And sorry if I'm going to do a little bit of humble bragging, but he was the Jose Rizal Model Student of the Philippines back in 2012. And he was one of the 10 most outstanding students of the Philippines back in 2013. So guys, if you do get to have a checkup from this doctor over here, you guys are in great hands and there's absolutely nothing to worry about. You'll be getting nothing but the best service and the premium treatment from this guest right here. So enough of all that. If there's anything I missed out, he will fill it in later. But ladies and gentlemen, let's give it up for Dr. Gio Alejo, MD.
Hi Jake, good day. Thank you for that great introduction, huh?
And the best part about everything.
You forgot to tell that you're my cousin.
Yes, I was just going to say.
Of course.
The best part about
the number one thing.
He is my cousin, guys. Yup. Meron bang discount? Libreng checkup, whatever.
Of course. Anytime, man. How's it been?
Okay lang. Ganun pa rin. Nasa quarantine. Still at home. But we're all getting work done. And everything's good so far.
Yep. I've been watching your episodes, huh? Good job.
Thank you.
Good job.
So before we do start, as usual, I may have given the introduction, but I'm sure Gio has a more comprehensive background about himself. So this is now your chance to introduce yourself to some of my listeners. So go ahead.
Okay, so to all of Jake's viewers, good day to you all. I'm Gio Alejo, as he mentioned. Yes, I'm a medical doctor. Actually, I'm a medical resident right now in ophthalmology here at the medical city. So I'm on my second year of training, and so as Jake mentioned, I've been a true blue guy all along, just like Jake.
Yes, sir.
From prep to medical school. Okay.
Wow.
So So right now, I've been going on regular duties. Just like what a typical doctor or what a typical resident would do. A lot of stories along the way. So, I hope to share them with you, depending on what Jake asks. But it's been one hell of a ride.
Yep, one hell of a ride indeed. And actually, I want to get into it right away. So, as you guys know, he is a product of Ateneo from the lower years all the way to the final year of residency. But I'm sure, I mean, as we all know, there are online classes going on in all levels, and medical school is no different.
Yeah.
But I do want to ask you though that the transition, from college to med school, because as you all know, some college courses have pre-med programs, and my sister actually, shout out to you, Kiara, for tuning into this episode. She is actually aspiring to be a doctor in the near future. She just took up BS Bio, and I'm sure you took health sci, if I'm not mistaken.
Yep.
So,
that's correct.
yeah, I just want to know, like, was the preparation from college to med school, like, was all the pre-med stuff that you were given back in your undergrad years, was it enough? Sapat na ba yun? Like, as you transition, from college to, your first few years of lectures in medical school?
Yeah. Thanks for that question, Jake. Well, what I can say about that is during college they'll give you all the preparation that you'll need. Well, for medical school we have some required subjects that we needed to take during college before we get into medical school. But actually, in some medical schools here in the Philippines, you don't actually need to take those courses. You can be accepted even without taking those. So it really depends on your medical school.
Yeah.
But what I can say is, even if you think that you're very well prepared during your college years, once you get into medical school, there will really be a great time of adjustment. That's what I would call it.
For sure.
The volume. So actually, the things that you'll be learning were pretty much the same with regards to the things that you learn in college, especially the first few years. So these are the basic subjects like biochemistry, biology, sometimes even anatomy. But I guess what's different with medical school is the volume of the input that you get. So, for example, in college, you take a course for 1 semester, which is around 2 months or 3 months. That whole content is summed up in around 1 to 2 weeks in medical school. Right?
Oh, wow.
So you need to adjust to that kind of pace, and I guess that's where it really boils down in terms of adjusting, in terms of prioritizing your time, because medical school is really more about going on and on about going about the daily grind. See, so and I guess that's the discipline that they're trying to teach there. Making a habit, creating a schedule, knowing which questions are important. Yeah, because these are the questions, and even when you go into practice, these are the more important things that come up. So it's really more of an adjustment in terms of not really your mental capacity, but more of the discipline.
Yes.
In terms of taking it all in. Yeah.
Yeah, I couldn't agree with you right there. Because if we are all being honest, like the whole surviving the grind, just following a daily schedule, doesn't really just apply to med school. Like it can apply to whatever field you're pursuing, whatever job you're taking.
That's good. Yeah, that's true. I
feel like it's really good now, regardless of whatever work you pursue or whatever dreams you pursue. It's all about just fulfilling your schedules and just meeting as much deadlines as possible.
That's true. Even if you take up law school, or even if you take up education or business, right?
Yeah.
So I guess it was just more emphasized in medical school because really that's like 5 more added years of schooling, right? When we should actually be working already. So yeah, but we would call it of course we would call ourselves the delayed kids, because like going back to high school, Jake, right?
Really?
When you were in college, the schedule was actually very free.
Yeah.
It's really very true to fix your own schedule, right? To enlist, etc. But when you go back to med school, it's like going back to grade school again. There are subjects that you need to take at a certain time of the day. There's recess, there's lunch, and there's dismissal. So yeah. So it's like going back to school to lower years, right?
Yeah. Ika nga yung old school style, like, if you will.
Yeah.
And actually, I want to discuss, like, I want to go deeper into those med school years of yours. Well, not the whole narrative from first year to 5th year, but like just tell me, like, what are some of your, I guess, best moments in med school, and like, what were some of your worst moments? Because I'm just an outsider, like I'm just an outside observer, but
So
I noticed. Sorry.
yeah, go ahead. Go ahead.
I noticed
What
kasi
do you-
na, we do have family gatherings sometimes, but usually you wouldn't be around, and understandably so, because you have a lot of readings, a lot of transies. Kaya sa mga med students dyan na nakikinig, like, it's all about reading your transies, getting your readings done, and really just studying for every test that there is. So I guess yun nga, just to sum it up, what were some of your best moments or favorite moments along there? What were your favorite moments in med school? And I guess what were some of your, not really worst, but what were some of your challenging moments? At least for the first 3 years, because we're gonna get to residency later. But what were some of the favorite and most challenging moments of your first few years in ASMPH?
Yeah. So of course, just like any medical student, I guess the first most memorable thing that you'll encounter is your encounter with your cadaver, right? So that's the dead body in front of you. And
dissection.
Slice it up. Yeah. So yeah, that's one of the first few classes that you'll take, anatomy, right? And then you'll be best friends with that cadaver for around 8 months before you completely dissect everything. So as you go through those 8 months, you'll go through the different body parts. So yeah, you'll take care of that cadaver. So that's really memorable because it's your responsibility to clean the cadaver, to set it up, to look at the different parts of the body. So that one was memorable. And then of course, maybe towards the latter part of first year, your first patient encounter is also memorable. So this is the first time that you'll be seeing an actual patient. Of course, with a licensed doctor beside you, since you're still medical students. But they let us do the interview, they let us do the talking, and then some bit of the physical examination. Okay, so these are moments that make you realize that you're really on your way towards becoming a real doctor. Right? There you go. And then when you were in second year, you would have our weekly exam. So that's a weekly exam. So every Monday morning is set for a weekly exam. It's 100 points, which will test you on all the topics that were discussed the previous week. See? So that's why when we have gatherings, I was just reading it's called transcriptions. So these are your shortcut notes to survive those exams, right? Low moments, well, of course, there's an occasional failing an exam. You just really need to suck it up and move on, because if not, you won't be able to survive, right? So that's really part of medical school. Even the top people fail sometimes. For me, well, I'm just glad I survived. Yeah, and then towards the end of third year, so that's the end of our classroom years, we had we call our revalida. Okay, so it was expected that we had a broad knowledge of all medical concerns and issues. So they'll just give us a random case of a patient, and then it's up to us to diagnose that patient's case, depending on what was given to us. And then there will be follow-up questions. What would you do? How would you treat? What are the public health issues involved? So that was one scary test.
Wow. So it's literally like a case study, kung gana.
Yes. The second oral exam, but you don't have a clue on what they'll give, because they can give any disease.
Oh.
Okay. So if the get-go, you kind of don't know what they're talking about, then you're dead.
Yeah. That's so true. Although I actually like that, the third year evaluation, how you're given a patient and you have to guess, or not guess, but you have to make sure what you're analyzing is correct. Because when you go to the real world, like when you're an actual doctor, it's not like the patient that will go to you will
exactly.
tell you what the illness is. Well, there's some patients like that, but for the most part, they'll just go to you for help. And ikaw na
So I guess
bahala.
that's the point of that, no? They're really testing or gauging how. Well, you don't really need to know it exactly, but you need to know. You need to ask the right questions.
Yeah.
To get to your diagnosis, right?
Mm-hmm.
Yeah, that's where the training comes in.
Mm-hmm. Wow, like that's just 3 years, guys. Like,
Yeah,
again, to all my med students, listeners, who are currently in med school, or for those who are dreaming about being a doctor, this is the stuff you're gonna have to deal with on a daily basis. And wala pa dyan yung residency, and that is the next part that we will discuss. And you can admit, Gio, that residency is like some of the bloodiest years of your med school life. Like we can agree to that, right?
Well, after your 3 years in classroom, you'll actually do an internship. So that's actually 2 years. So that's your 4th year. In some hospitals, they call it junior internship. For us in Ateneo Med School, we call it clerkship. And then after that, you'll undergo senior internship or postgraduate internship. Okay. So those are 2 years of training where you go into the hospital. So these are your every 3-day duty, if you've heard of that. So you're not yet a licensed physician, but you're actually part of the workforce already. Okay, so most of the time you assist the residents, which I am now, with the daily work because there are just so many things to do. It's not the resident will have his or her hands full without the help of these JIs and PGIs. Okay, so there, we underwent that training too. And yeah, right now I'm in residency. So, of course, when you're a resident, you're a licensed doctor now. So, the responsibility is much, much bigger.
Yeah.
So, when you're on duty, the buck falls on you. Okay, so you need to make sure that everything's ready. When there's a problem, you need to respond to it. Of course, emergency calls will be the first call. And then it's more than a 24-hour thing. And the next day, you go to ORs. And then patients downstairs in the clinic. So it's really a daily grind. And I guess we go back to the training in med school when you were still in the classroom. Although that was just a daily lecture, set schedule for you. Residency is pretty much about the same thing. It's also a daily grind. But right now, it's more of the actual stuff.
Yeah.
So like in Grey's Anatomy, that's them, right? That's their journey from postgraduate internship to residency. Although it really differs depending on what residency training you're taking up. Okay, so it's a bit more different when you're in internal medicine as compared to when you're in surgery, as compared to like when I'm here, like when I'm in ophthalmology. So of course the things you do kind of vary, but pretty much they're pretty much the same. Okay.
Yeah.
Going on duty, doing surgery or surgical subspecialties. In medicine, more of seeing patients in the outpatient department, and of course catering to our inpatient patients.
Wow, that is so...
See? That was just like 2 minutes of
that's
telling you everything that we're doing.
So detailed. That is
everything.
such a detailed description of what you guys are going to be going through sa residency. And I actually want to ask, like 24 hours a day, and you're pretty much on call, on duty. Pretty much anytime you're needed. So I guess how do you make yourself healthy? I think that's the appropriate question I can ask you. Like, of course, you cannot, or as a doctor or as a resident, you have to show your patients that, hey, I'm still functioning, I'm still like fully well. But it's hard to do, like when sleep pa lang, you already lose that. You lose a lot of sleeping time. And that can take a toll to your body. So I guess I just want to ask, how we're able to maintain not just physical health, but more so emotional and mental health, since that now is like the new stigma. Think about it.
Yeah, so that's true. You won't really get enough sleep, especially when you're in residency. But again, you've been trained even when you were an intern or junior or senior intern, right? So you kind of don't really bother about that much anymore. But well, I guess before the pandemic happened, I set some time for my fitness, etc. If I get a time to jog, actually I would go to Ateneo and just jog, right?
Yeah.
Then sometimes I wake up very early and then I go to the gym before they close down due to the pandemic. But
sad.
so you make sure that that's true. You make sure that you're physically fit and sound to go on duty, do your tasks, and well, at a certain point, your body will kind of really give up. No?
Yeah.
You'll get sick. Then you just rest for a few days, and then go back to your daily grind. So, I guess what's good is that we're still young. So yeah, I guess this kind of job is really for people our age. Well, towards the peak of our physical conditioning, because it's really taxing. So of course you also watch out on what we eat, etc. Okay. Although sometimes you can't avoid eating junk food, when you're very stressed.
Yeah, that's so true.
To comfort you, or like after a very grueling surgery or duty. Okay. So there. And then when you get a break, enjoy it. Okay. So because they come in four intervals. Yeah. But when you get a break, try to forget at least your hospital
responsibilities,
concerns. Yes. And enjoy time with your family, friends, etc. There.
Yeah, definitely. So guys, med school is certainly not for the faint of heart, and
that's
true. I guess
that's true.
Yung residency, it's all about sanayan lang, like as Gio mentioned.
Oh, and I think the more important thing there is before you decide to get into residency, make sure that this is something that you really want to do. Okay? Hindi yung pinilit lang.
Yeah, that's
so
true.
That's the greatest advice I can give, because if you really want it, even if you're in the lowest of lows or you feel that you want to give up already, you'll survive it, I'm sure. But even if you're like top one of the batch and napilitan ka lang pumasok on a certain specialization or a certain path after med school, I doubt that you'll survive. Well, even if you will, you won't be happy.
Yeah, you won't
right?
enjoy. Yep.
Yeah. So make sure that this is something that you really want. Okay?
Yep. That is definitely 100% true. And that just goes with anything in life. Like,
that's
kung
true.
Pinilitan ka, like, it doesn't matter. Like, you won't really enjoy every single day.
Yeah.
And this is not to say that whatever field you go, it will be 100% pain-free. Like, of course, there will be setbacks, there will be adversities, and there will be times that you will be tested. Like, regardless of whether it's medicine, law, or just your own passion projects, even freelancing pa nga, like, that has their own set of, adversities, doubts, and all that.
Yes,
but at the end of the day, so long as you stay committed and so long as you really feel that the desire is still there, like from day one until like the day you actually reach your culmination point, whatever that may be, I think at the end of the day, that's what's going to make it worth it in the long run.
Yep.
However, as much as it is important to enjoy these things or to just pursue what you want to pursue, now in 2020, if you're a doctor, there are some things na you have no choice, pero gawin mo yung mga duties. And I'm actually sorry for not mentioning this at the very beginning, but this episode is actually also an ode to our frontliners. So again, major props. Like, salamat sa inyong lahat for really just dedicating so much time, so much hours. I know this is not what you guys initially signed up for, Pero wala eh, no choice. We're in the middle of a pandemic that's getting, almost worse and worse every day. Pero nandito pa rin kayo every single day, like serving us. Which is why for my listeners watching, please, if you guys can, just stay at home and observe proper protocols in order to help our frontliners para di sila ma-burden, just to lighten off their load just a little bit.
Yeah.
So
and then, you would always see the frontliner images, doctor with a white coat or the nurse or the med tech. But, there are a lot more frontliners out there. Or security guards. Imagine that.
Yeah.
Grab drivers, lalamove drivers. Everyone, making life comfortable for all of us. So these are actually people that we also should thank.
Definitely. And actually, I wanna ask you, because make no mistake, you are a frontliner na rin, since you recently graduated, and I guess this was your welcome to the real world moment. This is technically your initiation moment, as a doctor. And did you expect this to happen? Well, of course, we all did not see this coming, but you as a doctor, were you prepared for emergencies or big time pandemics such as this one?
Well, of course not. Well, we only heard stories from pandemics before. Well, we had the SARS scare in the early 2000s. But whenever there's a new disease, we cannot really be very prepared for it, right? But there you go. We swore an oath, right? When we did our Hippocratic oath, and that means responding to your call of duty, especially during these times. So that's what I did. In the first part of the pandemic, last March, we were still struggling with the entity of the disease. Manpower was really short, and then they called doctors from other specializations to help out. Okay, so I volunteered in the COVID area, and we try to help out as much as we can. Okay, so and then I guess you just also leave it up to the experts to eventually see how this disease is managed, etc. And that's true. What you said. As a citizen, you just follow the guidelines. And well, you may not agree with all of it, right? But at least you try to be evidence-based. I guess that's what I'm trying to say here. So studies have been done, not just only here in the Philippines, but also abroad. Just try to read them, and try to see which recommendations are valid and which recommendations you really need to follow to stay safe, to avoid spreading disease or contracting the disease. So that's your job, as even if you're not a doctor, these are things that you can actually do, especially when you're at home, and when we have at your disposal other doctor friends who might do the same, right? And of course, it's also your responsibility to tell it to your household members, your friends, etc. Once you've deemed it fit that what you actually read about or what you think is right. See?
Yeah, definitely, guys. Basically, all these simple things, they may be simple deeds lang, but if anything, these are your civic duties, as a Filipino citizen or as a citizen of the world, a decent human being, if you will. It's just, practicing social distancing, washing your hands every day, wearing a mask when going out. Simple deeds like this that will really help us win the battle in the long run. And as Gio mentioned earlier, you may not agree, you may have doubts with certain guidelines, but just think you're doing our frontliners, you're doing our nurses, you're doing our doctors, and everybody else in the outside world trying to combat this virus a very huge favor of simply doing your part. So there you guys go. I do want to ask though, as a frontliner, are there any adjustments or were there any changes with the hospital setting pre and post new normal? Because I was reading reports that the medical city and all these other hospitals are in full capacity, and I'm sure you have like first-hand experience of some of these. So were there any new changes or like were there any differences with the medical environment, to say the least, pre and post pandemic?
Oh yeah,
not
definitely.
post, but right now.
So before, people were very confident going to the hospital, right?
Mhm.
And then COVID happened, and there was really a time when it seemed like a desert. There's really no one there because everyone was really afraid to go. Okay, and then there was a time when I guess the hospital was really full capacity. So we had friends calling us up, developing these symptoms, trying to see if there's still space, etc. Yeah, that was really a rough time. Well, right now it's a bit more stable, but I doubt that it will come back to the normal pre-COVID times, no, like before.
Yeah.
So most of the time you would do checkups by appointment. Okay. Diagnostic tests are all by appointment. So it's really more of control right now. Then before you enter, of course, you need to undergo the thermoscan, etc. Need to fill out a checklist to make sure that you don't have the symptoms. Okay. So, well, I guess what I can say is it's safe to go now to the hospital. Just practice the proper protocols, as mentioned a while ago.
Yeah, in short, don't let your guard down, even though things seem like back to normal.
But if you don't need to go there, don't go there.
Yeah.
I mean,
yes.
As needed though. As needed only. Okay?
Which is why, guys, also, like, another PSA, like, magpalakas din kayo, like, sa bahay. Like, as my mom would mention, just beef up your immune system, just, yun nga, proper sanitation, strong immune system, like all those would be more than enough to combat this deadly but beatable virus, if you will.
Yep.
So for you, like, as a personal frontliner, were there moments of like anxiety, or were there moments that you were a little bit scared? Well, not really scared for your life, but were there moments where you felt na, with COVID being all around us, it can hit me anytime, and I'm the most vulnerable, or in this case, you're one of the most vulnerable, since you literally are the frontliners,
Well, yeah. Well, there was a time when you just find out that your co-resident from a different department, or a nurse that you knew, or secretary that you knew contracted the disease. And then, well, the first thing that would come to your mind is, did I have an interaction with that person? Well, of course, with also trying to see if they're okay.
Yeah.
Well, fortunately for me, I wasn't able to, so far get the disease, knock on wood. But I guess there were also a lot of people who I knew who had relatives who got the disease. And well, at that point, we just really tried to help out. Either by pooling donations or giving PPEs. So in terms of me personally fearing for my life, there wasn't really that moment. But well, it's always there. Eh? The threat is always there, and I guess it's part of the job. So yeah, I guess it all boils down again to practicing the proper protocols. Bleaching all my clothes before I go up the house, etc. So practicing social distancing, avoiding going out, not talking while eating at work. Yeah, so those are small.
Really?
Well, yeah, we're trying to avoid that, so that you won't be able to spread the disease if ever you have it. But
it's true.
Yeah, so and right now we practice shifts, so we avoid being there in the office all at the same time. Okay,
Mhm.
there in the department, so that, for example, one person gets a disease, all of us won't be in quarantine. Diba?
Yeah.
So those are techniques that you try to enforce, to adapt to the situation.
Mhm. Mhm.
Okay.
Yep. Wow, that is very informative, but also very important to follow. And
Yeah.
guys, like, take all these advice with a grain of salt, also, because you're not just hearing this from any other guest, but like I mentioned earlier, like, this is from one of the best doctors that ASMPH or even the Philippines has produced. So, I feel that his advice, along with everyone else's, all the other doctors, all the other medical experts, really just take them with a grain of salt, but more importantly, just try to follow them as much as possible, because they'll really go a long way as we continue to combat this virus. So before we, wrap it up, uh,
Yeah.
what are some of your tips and pieces of advice? Now, I'm sure we had stories a while ago, and major thanks to you for sharing them to some of our listeners, whether they're interested in med school or not.
Yeah.
But for those who are interested, just like my sister,
Yeah.
if you think about it, it's 4 to 5 years of pre-med stuff in college, and then 5 whole years in med school, 2 of which being in the residency ward. Like, what is your advice
So
to some of my listeners who may want to take med? Like, it's 10 whole years right there of their life.
Yeah.
So what's the advice?
Yeah. So one of my mentors, well, actually, it was his birthday yesterday. Si Dr. Shaw Marquez. Happy birthday, Doc.
Yes.
I guess the theme of our talk this morning is really about vocation, right?
Mhm.
So it's not a career, it's not a profession. It's really vocation. What's your calling in life?
Mhm.
His wise words were that your vocation is the intersection between what you want and where you're needed, right?
Yes.
So to everyone out there, I guess that's the intersection that you really need to look for. What do you want in life, no? What do you want to be after 5-10 years? But at the same time, you also think about where you're needed the most.
Mhm.
What's the situation right now in the world, the country? Where can I maximize, this something that I want in order to help, our situation right now, or where am I needed the most? And that intersection, I guess, it's really your calling, it's your vocation. Okay, so this doesn't come in an overnight sleep, right?
Definitely.
It takes a lot of thinking. It takes a lot of discernment. Okay, it takes years, no, even. So take your time. Make sure when you make that decision, you won't regret it, right?
Mhm.
And actually, sometimes you don't get in the first try, right? But if that happens, just try to discern again. Try to think about it. Try to pray for it. No? And hopefully, there will come a time when you'll tell yourself, this is where I really am meant to be. Okay?
Mhm.
There, that's it. Because med school, or at least for medicine, or those trying to become doctors, it really won't be easy. See?
For sure.
It won't be easy. So that should be a given to you. Okay? But again, it all boils down to, do you really want it? Are you going to use it properly? So I guess if the answer is yes and yes, then give it a try.
Mhm. Yeah.
All right?
Those are wise words there from Doc. And really, at the end of the day, it's all about discerning what you want, but also knowing where you're most needed. I think if you can answer those questions well, you won't get it as the first try, but if you can answer these as you go along with your life, I think you're gonna be good. You're in great hands, like wherever you are destined to be in. But also, we can't forget about the frontliners, and they've really been killing it out there. We can't thank them enough.
Shout out to all. Yeah.
Yep. Can't thank them enough for really serving our country. And not just frontliners here, but all across the globe. I mean, you guys have been really solid. Like, you guys are literally rock stars,
Yep.
So,
All right.
what are your? Well, before we go, what are your? What's your message? There we go. What's your message to our frontliners today? Because I'm sure they're feeling drained physically, mentally, emotionally, even socially, because there's a sense of isolation. Because just the thought of trying to meet a doctor who's been exposed to such viruses, that can be haunting for a normal patient and stuff like that. So what's your message to our frontliners who've been really doing a great job, serving all across the globe against this virus?
Yeah, so special shout out to all our frontliners. Hasn't been easy, no? But well, with your determination and your passion, I'm pretty sure we'll survive this pandemic. Okay. Well, a lot of lives have been lost, but they died as heroes, and these are really the new heroes that we need to emulate. Okay.
Facts.
But yeah, I mean, as I said, Jake, they swore an oath, and I'm sure that they knew the risks coming in. Okay, and yeah, that's why we go to the hospital pa rin every day. Not just the doctors and nurses, I said, all medical professionals, non-medical professionals who are frontliners, they just really swore an oath to do their duty. So, big thanks to everyone, and we will have new breed of doctors, professionals, nurses, etc. And yeah, I hope you'll be as game and as ready as our current frontliners, our current heroes, to respond to the call if need be.
Yep. There you guys go. So again, to all the frontliners, your efforts are not in vain, and you guys are really saludo ako sa inyo, and actually saludo kami sa inyo. So just keep doing what you guys are doing out there, but do know that as regular citizens, we're here, nandito lang kami para sa inyo, we're ready to help whatever type of help you guys need. So before we really go, sorry for keeping you here for a while, but what's your fearless forecast? When do you think this whole thing is gonna end? We never really know, but as a doctor, maybe your predictions are more credible than ours. So, what's the realistic?
It really depends.
What's the realistic period?
Well, I guess it really depends on when the vaccine will be developed. Okay, so I guess maybe in a year's time it will be more stable. Depends.
Yeah.
Once that vaccine is developed and it's given out, then maybe things will get back a bit more to normal. But I don't really think it will get back to the situation like before. Okay.
For sure.
Everyone will be more guarded right now, which is good. But yeah, it really depends on, for me, a credible vaccine that will be developed. All right.
Yeah. So with all that, thank you, Gio, for being here. It was truly a pleasure talking from one of the best doctors out here. Do you have any plugs though before we do go? Like, do you have any?
No, man.
No plugs. It's okay.
Your family.
All right.
Right.
So, thanks again, and also happy birthday to Doc Shaw. He's one of the popular professors in Ateneo. I've never had him though.
You know him, right?
Yeah. It's a pretty legendary professor, to say the least. So, yeah, shout out to you for that. So no plugs for Gio, but that's okay. But for me, if you do want to follow me on Instagram for the podcast account, it is at JOAT.pod.DELRO. So once again, it is at JOAT.pod.DelRo. If you want to check out my personal account, it is at Jake_Delro. If you want to check me out on Twitter, it is at _Del_Ro_. On Facebook, it is facebook.com/JOAT.pod.DelRo. So it's just like my IG. Or if you want to just search it on the search tab, it is JakeOfAllTradesWithDelRo. This podcast can be televised, viewed, streamed, and listened to on the following platforms: Spotify, Google Podcasts, Anchor, Radio Public, Breaker, and on YouTube. With all that out of the way, that's a wrap, y'all. Thank you for tuning in today, mga Del bros and sisters, and to all the doctors and frontliners out there. This has been your one and only Jake of All Trades, and he is Doc Alejo, and we're both signing out. Hanggang sa susunod na usapan at chikahan. See ya, stay safe,
Bye.
and wash your hands.